Welcome, everyone, to the Medicare Team podcast. My name is Joshua. I'm a licensed agent, and today we're just going to be going over some of the big changes when it comes to 2026 Medicare, in particular, your Part D. And Part D meaning for your medication coverage. We're just going to be going over some of those changes as well as some others if we have time in this podcast. And I'm joined here with...
And my name is Sean with the Medicare Team. I'm also a licensed insurance agent, and I've been able to help out hundreds of clients this past year with their Medicare benefits.
2026 is some of the biggest changes we've seen
Absolutely.
when it comes to your Part D and prescription drug coverage. So we're just going to go over some of those changes with y'all today. So we're going to start off with going for the maximum out-of-pocket changes when it comes to your prescription coverage for 2026. The prescription coverage for 2025 was set to $2,000, meaning that your max out of pocket, let me just go into that. Sorry, I'm diving a little deep here first. So your maximum out of pocket is the maximum you're going to pay for your prescription medications in a plan year that are covered by the plan. So for 2026, the maximum out of pocket was increased from $2,000 to $2,100. So that's a big increase. $100, baby.
Definitely a big increase. Also makes you kind of wonder why the increase.
Why the increase? Yeah. Everything's always going up.
Everything's always going up.
The gas is always going up, the electric always going up, and your medication prices going up. So it's very important to make sure that we utilize what plan covers your medications the best so that you're not even having to worry about hitting that limit. But
and I do think that's the most important thing is, one, finding you a plan that covers those medications the most effectively. Especially like Josh was saying with the big changes that are coming from 2025 to 2026. I think the most important thing is doing that annual checkup, checking up, making sure your medications are still covered, making sure that, there isn't a medication now that you're going to have to pay hundreds of dollars for. And, if you do with your current plan, that it is important to, call us and we can help you take a look at some plans that potentially cover them more effectively or cover them entirely, hopefully.
For sure. So I'm just going to go into what a max out of pocket is. So whenever you're paying for your medications, whether you're in your deductible stage, there's 3 stages to prescription drug. This is for people who don't have government assistance. So you have your deductible phase, and this could vary from plan to plan. Some plans don't even have a deductible, some do. But during the deductible phase, you're paying 100% for the cost of your medications until that amount is reached. So for instance, if your deductible is $316, you're going to be paying fully for your medications up to that $316. And then you hit your initial coverage phase. So during your initial coverage phase, you're going to be paying just the set copays or co-insurance that's on your plan. And like I said, this can vary off of what medications you're taking and what plan you're on. So it's important that you talk to a licensed agent just to figure out what those prices will be, because we have the tools and the software to be able to help you with that. And then you have your catastrophic phase, and this is where the maximum out-of-pocket comes into effect. So the catastrophic phase is after you hit your max out-of-pocket limit. So after you spend out of your pocket $2,100, you're going to be paying $0 for the rest of the year for all your covered medication. If you're taking something over the counter or something's not covered, you're going to still have to pay out of pocket for that. That's a big mistake or misconception that a lot of people have, is that once they hit their max out of pocket, those not covered things are going to be covered. But it's only for your covered medications. So you want to make sure that your medications are all covered if they're able to. So,
and that's even more of a reason that you want to call, a licensed agent and just make sure that, one, this year nothing's changed as far as your medications go. They're still all covered, because like Josh said, if you have 1 or 2 medications that aren't covered, even once you do hit that max out of pocket, it's not going to alleviate that cost for those ones that aren't covered. You're still going to have to pay for those. So it is important to, like I said, call us, make sure that, 1, your current plan still does cover those medications. And if it doesn't, we can definitely help you, try to find a more comprehensive option.
Yeah. And if you found this episode because your prescription prices just immediately went up in the new year and you have no idea why, there's a lot of reasons that could happen. For instance, one of your medications might have changed what tier it's on. So when I list out when you go into a plan, it ranges from 1 to 5 or 1 to 6 if you're in a special type of plan.
Hmm.
But your tiers are listed from 1 to 5, and depending upon what tier it's on, it depends on how much you're going to end up having to pay for it. So in between years during like the annual enrollment period, which is October 15th through December 7th, or if you're outside that period, still call in. There might be a way we're still able to save you money. But if you're seeing your medication prices suddenly hike up, it's very, very, very important for you to call in and see if we can't help you. Because in between years, from January 1st of every year, the plans all change,
Hmm.
and they can change where your medications are covered at, if they're covered at all. Also, another thing is your pharmacies as well. There's certain pharmacies that insurance companies make deals with that have better rates than other ones. They're
Hmm.
called preferred
That's
pharmacies.
a big one.
Sometimes these pharmacies can become unpreferred, so you'll have to pay more for your medications when you get them there, or they could just lose coverage at that pharmacy. And that doesn't necessarily happen just at the end of the year. You could see it in the middle of the year.
Hmm.
So if you're ever seeing your medication prices hike up, or you're going to your pharmacy you've gone to for years and they're saying, "Oh, I'm sorry, we don't accept your insurance anymore," it's important to call in because there's lots of companies that work with these pharmacies. It's very possible you could still go there. You might just have to see if there's any other coverage that'll be able to cover your medications
Hmm.
that covers that pharmacy as well.
Yeah, and that's a great point. It's funny enough, I actually had a situation like that where somebody was using their plan's preferred pharmacy, and it was a far drive. It was like, I think 30 miles for them,
Hmm.
so a pretty far drive. And then that pharmacy actually became, like you said, unpreferred, and a pharmacy that was much closer to them became preferred. So I was actually able to let them know that, and then instead of traveling such a far distance, now having to pay more for what they were paying, they're actually able to go to that much closer pharmacy and have a much lesser cost for those medications.
Yeah. And we're talking about this is for people who don't have government assistance. So let me just talk about what government assistance does for people if you're on it or you're looking to see if you can't get on it. So you have your run by the Social Security Department, you have your extra help program. So that program can help pay for your medications. It can lower the cost to standard rates every
Hmm.
year, depending upon what tier of extra help you get. But it can really subsidize that cost. But another thing it can do is it skips the deductible phase. So for instance, what like I was talking about earlier, during the first phase of your medication coverage, whatever you're having to pay fully out of your pocket, the plan will take care of it covered. You're just paying the subsidized rates. So getting extra help for your medications is very, very important, especially if you have lower income. It doesn't hurt to look into it at all.
Yeah, definitely doesn't hurt.
Just call your social security department or your local social security office. They'll be able to tell you a little
Hmm.
bit more about that program and see if you qualify for it. But getting extra help could help you save money on your prescriptions.
Yeah, and that's a great program. I and you'll hear us talk about this in one of the episodes, the Part D late enrollment penalty. And extra help can actually alleviate that
Yeah,
penalty, and where you wouldn't have to pay that if you had extra help. So it's
yeah.
another great thing that it helps with.
So yeah, I'll go into a little bit here what
Hmm.
the late enrollment penalty is, just in case you didn't catch our next episode here. So the late enrollment penalty is whenever you enroll into a prescription coverage or your medical coverage after 65 without having something else to be a replacement for it. So like you don't have any qualified work coverage
No
or
VA, no
nothing through the
TRICARE.
VA or
Yeah.
anything like that. You're going to have to pay a penalty when you in the future would have to rejoin. Let's just go for example. So for instance, if you want to join a plan that has prescription coverage, that would normally be $0 a month. Every single month that you're not on prescription coverage after you're 65, you're going to have to pay a penalty. So let's say, for instance, maybe you're 12 months without having Part D coverage, Part D meaning prescription coverage, then you might have to pay maybe an extra $10 a month
Hmm.
or so. forever for the rest of your life. And it's just a percentage penalty that you have to pay. So it's very important that whatever your first agent gets of Medicare, that you get that prescription coverage, so you're not having to incur those higher costs later in life when you have higher medical expenses, and you really want to make sure you avoid that penalty. And then let's see here, the next topic I think we should get into here, as a big thing we had someone actually call in yesterday, is the food card changes.
The food card changes, that
Mhm.
is a huge one for this year. And I've actually had a lot of people call in, and that is pretty much their primary upset. They are very frustrated that they were once able to use that over the counter card for food and groceries and all these things. And now with the new year coming up, they're not able to do that. And the reason is they made a nationwide change where, in order to use that over the counter card for food and groceries, you have to have a qualifying chronic condition to be able to use it for those things.
Yeah, and this is different for every single carrier, which is why it's really important that you call in
Hmm.
to a licensed agent who's familiar with this stuff, who's been through the weeds with this. It's
Hmm.
a big change. A lot of people are affected.
Very big change.
The guy who called in yesterday, he was like, ever since the new year, I haven't been able to use it. And you're not able to use it on anything but over the counter products. And
Yeah.
a lot of times, especially if you're on these like full Medicaid plans, you're getting a couple $100 a month.
Yeah, and that's really tough to go from having
Yeah,
$300 that you can use at your grocery store to now having $300 that you can only use for over-the-counter items like Band-Aids, toothpaste, things like that.
yeah,
Now, how do you get the groceries that you were once able to buy? It's
yeah.
it's a big change that affects a lot of people.
Yeah, you don't really want seniors to have to start resorting to buying Advil and selling it out on the street
Yeah.
because we don't need anything like that to try to afford groceries. But it is very very sad that some seniors are going to lose access to that
Mhm.
for sure. And that was a program a lot of people were relying on to be able to maintain their lifestyle, especially if you're lower income. So we really want to make sure we take care of you, and there's a wide variety of conditions from like I believe arthritis in one organization, that's a qualifying
Mhm.
condition. They estimated that 90% of people are still going to be able to use it. So if for whatever reason they're telling you you can't use it, please reach out to us. We'd
Yeah.
love to help you, see if we can't find a way to get you in. And every company's different when it comes to these sorts of things. So if we're able to find you a company that would be able to allow you to use it for those things and still give you the coverage you need, that'd be very beneficial for a lot of people.
Yeah.
Mm.
And it's tough because even though they may say it's 90% of people still be able to use it, we do talk to a lot of people that are rather healthy, rather active, and unfortunately, those people that don't have a chronic condition like that just can't use it as they once did before, which is really unfortunate.
It is very unfortunate, and we're really looking to take care of everyone. And it's very sad to see people in those bad situations where uh, they're gonna have to go. They're gonna have to go out and get a job again, just because they just can't afford anything. Just living on Social Security, such a limited income, you
Hmm.
really need to make sure you're maximizing every single dollar you get. So it's definitely, I've seen lots of people in tough situations,
Hmm.
like that. Lots of widows or people who just have no one to look after them. They don't have any sons, daughters, and they're just a lot of people I've seen hopeless.
Yeah, which is
To be
it's
honest,
very sad.
it's very very sad situation we have.
Hmm.
So anything we can do to help is definitely going to be most beneficial for people. So let's see here.
And just to touch on that right at the end, it is tough. Like I said, when you're going from having, especially if you have Medicaid or some of these government assisted programs, you go from having a couple $100 for food and groceries to now only being able to use it for certain things. And then not only that, but another change of 2026 is that the Part B premium went up. So it went
Yeah,
from 185 up to 202. So not only now are you paying more each month, but you've now lost the capability to buy groceries with that extra card that you had. It's a
yeah.
lot of changes that are affecting a lot of people this year.
Yeah, and then I also want to go into the prescription payment program. So I believe every organization offers this. A lot of people don't know about it. If you have very, very high upfront medication costs, whether you have a high deductible and you're taking lots of medications. There is a program that spreads that cost out for the rest of the year.
Mm.
So you're able to you're able to pick up your medications at the pharmacy. You're not paying anything there, and then they bill you monthly. So they spread that high cost that you might have at the beginning of the year, which a
Wow.
lot of people can have because of that deductible, to the rest of the year, so it makes it more affordable. It doesn't lower the cost, all it does is,
Makes
kinda
it a
like,
little more manageable.
yeah, if
Yeah.
you, like, have, like, bread with, like, a piece of peanut butter and one big blob of peanut butter here is your
You wanna
cost, it
spread it out.
spreads that out through
Yeah.
the entire year,
Yeah.
so, um, being able to do that definitely can help a lot of people, especially if you don't have a big cushion of
Mhm.
money there to be able to hit your deductible fast, so.
Yeah. And touching on that, I've talked to a lot of people where unfortunately, their issue is that they just can't pay for their medications. You know what? I've talked to some individuals that have to pay upwards of $1,000 or $2,000 for their medications, and they're like, "Listen, I just don't have that money to give right now." So a program like that could help them spread that cost out throughout the year, and make smaller payments to cover
Yeah.
that.
And that's for sure. That's for all covered medications. I'll say that as well. So if one of your medications aren't covered, it's not going to qualify for that program. But if your medication's covered by your insurance, then you will be able to sign up for that program. And like I said before, it's great for people who have a very high upfront costs. It's not so good for people who just have about the same cost year round. Because what will end up happening is it will spread that cost out through the rest of the year, but it's actually gonna cost you more at the end of the year because
Mm,
most of the cost is gonna be put to the end of the year,
mm,
which could be kind of shooting yourself in the foot there.
hmm.
It's really good for people who have very high upfront costs in the year. So just don't wanna abuse that program. It's out there for specific people in very specific situations.
Yeah.
So, Sean, whenever you're going into pick a plan to try to, like, help someone out, what are you looking for first in that plan?
Yeah, so it definitely varies when I'm talking to the person. Obviously, we do a small needs analysis of basically, how is this person going to use this plan in the upcoming year? Those are definitely the questions that I would ask first and then use that knowledge to help me find a plan. The other thing I would look for is drug cost, especially with all these changes in 2026. I'm looking at, which medications are covered for them, which are not, and how much, if they're not covered, how much it's going to cost. If I see a plan that, let's say someone's taking 10 medications and it's a wonderful plan, it lowers all their copays, they're getting, a great food card, they have a chronic condition, so they're able to use it for that, for food, but it has, five of their medications not covered. I'm probably not going to recommend that plan just because, yes, you do get, a ton of other benefits, but if you're going to have to pay more than those benefits give you for your drugs, then it doesn't really make much sense. And if I saw a plan that covered all those medications, but maybe had some slightly higher copays, I would let you know of both. And I would probably recommend the plan that covers all your medications. I think with these plans, medication costs is going to be what I usually see some of the highest.
Mhm.
So I definitely am always looking at a plan that covers all of the client's medications first.
For sure. And then what would you recommend people do, like, if they have a really big life change in the middle of the year, such as they're moving, or they just have a big change with their healthcare, with whether that be like a big surgery or
Mhm.
unfortunately, like if you get cancer, I mean, these things do happen. Is there anything you'd recommend someone in that situation do?
Yeah, I think if they're moving, I think that's definitely where I would want you to call us. Moving's a big opportunity where you do have to have that plan available in that new area. So,
Mhm.
say you were on a wonderful plan that covered you in every way possible. It covers all your medications. It has all your doctors that you need, but you're moving to a new state that it doesn't offer that plan. Then it's our job to help find you a plan that's equal to the plan that you had before, one that covers those medications, gives you the benefits you need, has your doctors, all that. If you had a big health change during the year, I would also want you to call, whether that be, God forbid, cancer or, a big surgery that you had. I would definitely want you to call and just see if maybe we could find you a plan that helps cover that procedure or, helps alleviate some of the hospital costs that you may have when you have that done. And, even if you don't necessarily want to change, again, I do think it's important just to call in and just check on benefits and just see if there is anything out there that could help you in your current situation. Obviously, throughout the year, a lot of things change with individuals. So, switching insurance can be scary, but I do think that if you have a big life change like that, it is important to just take a double look and, make sure that that plan is still made for you and
Yeah.
benefits you in the best way.
And another big life change I was just thinking about here that I want to talk a little bit about if you were recently diagnosed like with a chronic condition. So if, whether that be like a heart condition, cardiovascular
Hmm.
disorder, if you had a heart attack, a stent put in your heart, as well as like having diabetes or
Hmm.
pre-diabetes, even I've seen.
Yep.
You can qualify for a special type of plan called a chronic special needs plan, and these plans can often offer additional benefits
Hmm.
for people depending upon their situation. So it's if you're running into that life circumstance where unfortunately you're getting diagnosed with one of those conditions, for sure call in. And in certain areas, there also are lung plans as well. If you have like asthma or COPD, things of that sort. As well, I've seen there's special plans in certain areas that's not as widespread as the other conditions, as well as you have any like kidney issues and stage renal disease uh, as well. I've seen some plans designed for those specific conditions, though they're not as widespread as
Hmm.
your heart and diabetes plans. So,
Yeah, and I'm gonna jump with Josh on that one. I think it's a great idea if you have any of those chronic conditions, or even if you're new to having those chronic conditions, you just
mhm,
got diagnosed. I think it is important, like he said, to give us a call and just see if there's a better plan. I've seen a lot of those chronic special needs plans that you were talking about. They offer things like transportation. Some of them offer like diabetic shoes and diabetic glasses, so they really can fit someone's needs, especially with those chronic conditions.
for sure. And it can definitely make, they have their own special tier. I was
Hmm.
talking about this earlier. These types of plans have a tier six.
Mm,
There are medications that are specifically designed to help you treat your conditions. And a lot of times they're covered at a $0 cost.
you are
So,
absolutely right.
so as well, these plans can definitely lower your costs if you have that chronic, condition. But if you qualify for sure, give us a call. We'd love to take care of you.
Definitely, yeah, and especially this year with all the Medicare changes happening, not just the Part D, but that Part B premium, all the drug changes. I think it is really important to, if you do have a chronic condition, or even if you think you're borderline. Some things even as small as high blood pressure can sometimes qualify you. So, I definitely think it is, very worth it to just give us a call and see what's out there, and see if
Yeah.
it can help you.
See if we can't take care of
Yeah,
you, find anything. Like I said, no downside to you. So down below, wherever you're watching this, the podcast, whether that's in Spotify, YouTube. If you've enjoyed, if you got anything out of this content, we would ask you to please follow or subscribe or whatever platform you're watching this on. Follow us so that you're not going to miss out any future content. As well as there should be something in the description or in the comments below where you're able to book with one of us. If you don't have a licensed agent now, we'd love to be that for y'all in the future and be with you during your entire Medicare journey.
yeah, and that's what the Medicare team does every day. Like Josh was saying, if you have any questions about how the 2026 updates might affect you, always give us a call. Again, numbers 1-800-217-1754, and we'll always be happy to help you out.
I do want to thank everyone for watching this episode. Next episode, we're going to go into some common mistakes that we've seen people make. So we just filmed that one right before this. It's a really good episode.
Very good.
Lots of stories in it.
Lots of
So,
stories. There's a lot of common mistakes that seniors make when it comes to Medicare. So
and I'll give you a little hint. There's some teeth involved. So, so we look forward to seeing you in the next podcast episode. Thank you for joining us today.
thank you.